You know, the docs are out here trying to help with people's health, improve their health. In some cases, there are even cures for medical problems, but in most cases, it's about just trying to improve health. There are a lot of misconceptions about what's good and what's not good, and so a lot of what we do is dispelling rumors and directing people to making good choices in their lifestyle and in choices of medications when it comes to that. But above all, do no harm is kind of the general idea. The next slide that I slipped into was here it is. This role of cannabis in health is all about understanding something about the endocannabinoid system. And, you know, maybe briefly, just show of hands, do you have some idea of what that is? Just put a hand up if you do. Okay, cool. Well, all animals have an endocannabinoid system, perhaps excepting insects. We're all built with this, and it goes way back into evolutionary time to the sea squirts and hydra and really primitive creatures. So the system is designed to bring us into homeostasis. That is to say, it helps us to relax, to eat, to sleep, and relax, and to protect our bodies. So it's built into all of our bodies already, and it works in a fascinating way that I'll take you through for a little bit. That next sentence, it modulates pain, neuroprotection, immunity, neuroplasticity, inflammation, apoptosis, and carcinogenesis, emotional memory, and embryological development. You can see it covers a wide range of roles in the body, and I could talk too long about any one of those, but that's really beyond the scope of what we're trying to do today. So again, the entire animal kingdom is endowed with this endocannabinoid system. It probably dates back something like 600 million years as far as animals having this system built into their nervous system and into their immune system. If you radioactively label THC, one of the constituents of cannabis, or any cannabinoid, and inject it into the body, that particular molecule will find these spots in the brain, and I'll show you the next picture is in the rest of the body. You can see that it's very highlighted in specific organs within the brain. So it's doing a very specific role in terms of relaxing, eating, sleeping, and so forth. In the rest of the body, if you look to the right side of the picture, you'll see the liver is lighted up, and the bones, the vertebrae, the pelvis, the lymphatics all over the body are rich in endocannabinoids. And the circulating cells are, on the right you'll see the CB2 is located in monocytes, macrophages, B cells, T cells, liver, spleen, tonsils. All of these are part of our immune system. So this system is rich in endocannabinoids. And in the nervous system, the column on the left is primarily in the central nervous system. And from there, it's found really probably by way of the distal neurons out in the organs throughout the body. So fatty tissue, connective tissue, and so forth. All of these organs are found to be rich also in endocannabinoids, probably rooted in the nervous system of those organs. So just briefly, I want to give you an idea of why this is such an exceptional system. You probably have heard about neurotransmitters, and in this case, glutamate is the neurotransmitter with the little blue dots. And as the neurotransmitter gets into this synapse between neurons, it conveys the signal. So if you have an impulse coming down one nerve, there's a release of a chemical to cross the cleft and find a receptor, and when it hits the receptor, it propagates the signal. So what the endocannabinoids are doing is they're built into this postsynaptic neuron cell. You can see that molecule on the right represented just here. And once the activity of the glutamate begins to pick up, the endocannabinoids, the natural cannabinoids, are being made on this surface of the postsynaptic cell. They cross over in the opposite direction of the neurotransmission. And when they hit this receptor, the CB1 receptor, they will block the production and the release of the neurotransmitter. So effectively, it's like the brakes on our nervous system. It's the modulator of the nervous system, and in fact, it sets the tone of our nervous system. So if there's too much pain or too much anxiety or too much of anything, the endocannabinoid system is designed to put the brakes on the system and correct us. So that's basically what it's doing in the nervous system. In the immune system, it's not quite as clear-cut, but there are some remarkable roles that the endocannabinoid system has, and I wouldn't say they're particularly well understood at this point, but the cannabinoids have an intimate role in the function of the immune system. They, in general, like the nervous system, downregulate the system. So one would worry, well, if we're downregulating our immune system, does that make us prone to disease or infection or anything else? In fact, that doesn't seem to be the way it's working. It protects us. So whenever we're exposed in our environment, let's say to smoke or something like that, our body could go into quite a bad reaction, and in rare people we do. We have, anaphylactic reactions. We have asthma and things that occur. But what the immune system does with the cannabinoids is it protects from overreacting. So again, it's a downregulating of the natural immune system. And in a couple pieces of research, the Nagarkatis are a couple in South Carolina. They've shown that it works very well in using cannabinoids in what is the host versus the graft reaction in organ transplants. You get an organ, the rest of your life you're going to be taking immunomodulator drugs that will downregulate your immune system so that you don't kill off your organ. Well, cannabinoids do the same thing in a natural sort of way. And so when we use cannabis, we're augmenting that and we're protecting from the host killing off the organ, the transplant. And then another interesting piece of research came out by Molina down in Mississippi, and she showed that when they infect macaque monkeys with the virus that's essentially the HIV virus, it's called the simian immunodeficiency virus, that the animals did much better. They survived, whereas those that had the virus otherwise died. So if they gave THC to the animals, it protected them. So in her words, it ameliorates disease progression, attenuates viral load and tissue inflammation. It's significantly reducing morbidity and mortality of the SIV-infected macaques. So it's not harming us to downregulate the immune system. It's doing things that we really don't quite fully understand, but it's a good role. So going on to the next little snippet, this is out of some research that has come out of NIH. These are a couple guys that are in the federal government's NIH system, and they're doing research on cannabinoids. They know cannabinoid research as well as anybody. And what they've said in a paper just 2 years ago is modulating endocannabinoid activity may have therapeutic potential in almost all diseases affecting humans, including, and then the laundry list: obesity, metabolic syndrome, diabetes and diabetic complications, neurodegenerative, inflammatory, cardiovascular, liver, gastrointestinal, skin diseases, pain, psychiatric disorders, cachexia, cancer, chemotherapy-induced nausea and vomiting, and many others. These are not friendly people to cannabis. They are studying the cannabinoids as a class of molecules, basically to hand it over to the pharmaceutical industry to bring us a new generation of medications. They are the same guys that may be vilifying the plant, but they recognize the value of these molecules. And in saying that, I'll just go on to show you the federal patent granted to the Department of Health and Human Services in 2003 for cannabinoids as antioxidants and neuroprotectants. They did so much research on giving THC and other cannabinoids to animals and seeing the benefits that they experienced whenever they tortured them, basically. If you tie off a blood vessel and cause a stroke in a couple animals, and one of them you give cannabinoids to, it may reduce the size of the stroke, if not protect the animal altogether from even showing the signs of a stroke that would be there otherwise. So these protect the body. These molecules are very important in protection. So that's what this is about. If you want to have a patent on a cannabinoid, you got to go through the federal government to get it. We're talking synthetics in this case. So briefly, This molecule, this cannabinoid receptor molecule, is something that's produced in the body. It's a 7-transmembrane G protein receptor protein. So it's made, it migrates to the surface of the cell, and it sets up shop to be activated by cannabinoids. And so this is an image of what it's like in the CB1 and CB2 on the left. The green dots are in the CB2, the mobile ones. The CB1s are the blue dots, are the ones in the nervous system. And then there's just an idea of what this might look like when it's wound through the cell membrane. Basically, it sets up a socket for cannabinoids so that the tail of the cannabinoid molecule can get down into this cluster of cells and cause things to happen. Basically, reduce inflammation, stop seizures or prevent seizures, and on and on and on. Many helpful things that occur. This is just a picture of a couple of the natural cannabinoids. They are the ones that your body makes all the time right now in protecting and well, let's just say protecting ourselves. I think the thing that's interesting here is both of these molecules, the anandamide and the 2-AG, these natural cannabinoids, have a 5-carbon chain at the end. 1, 2, 3, 4, 5. It's like a tail on the molecule. So there's kind of a head end of the molecule and a tail end of the molecule, and the tail end dips down into that receptor, and when it's down in there, it activates good things to happen. I'll skip over the details here, but these molecules are made right at the places that they're needed, and then they're broken down right there as well. So they come and go rather quickly from our bodies as they're called on to be needed. Comparing to THC and CBD, a couple of the natural plant cannabinoids, again, you can see that 5-carbon tail. Got it? Here we go, 5-carbon tail at the end of CBD and THC. There's a difference, however, and it's that one of the hydrogen atoms from this methyl group in THC is freed up to go to this oxygen molecule at the bottom of the ring. And when that occurs, you have to double bond to the other, to the carbon. So it changes the shape of the molecule. It opens a ring, and it doesn't work the same way. The big difference for us is not so much in the pharmacologic roles of CBD and THC. They're almost identical. But the big difference is CBD doesn't cause psychoactivity. It doesn't get you high. So, in fact, it gets into the receptor, but it doesn't activate the receptor. It's not an agonist to the cannabinoid receptor, but it kind of bumps THC off so that when you're using CBD or CBD-rich products, you don't get high, but you get the pharmacological effects. The endocannabinoid systems don't all work the same, and this is research that's fairly new to cannabinoid science. We call them SNPs, or single nucleotide polymorphisms. If we're looking at the genes that make these proteins, we know now that there are many forms of that gene, and that the genetic variability in the endocannabinoid receptor affect the functionality of the endocannabinoid system, resulting in a spectrum of clinical endocannabinoid deficiency syndromes. So up to this point, this list of diseases have been noted to be probably resulting from endocannabinoid deficiencies. It's schizophrenia, migraines, multiple sclerosis, Huntington's, Parkinson's, irritable bowel syndrome, and I'd have to add to that inflammatory bowel disease from my own research. Failure to thrive, loss of appetite, motion sickness, fibromyalgia, menstrual symptoms, seizure disorders, and mood disorders. If you look at those genes and compare them, you can see clusters of how the genes in depression might be similar in a group of people that are depressed. Even there's a fellow named Matsunaga a couple years ago that showed that people with a happy disposition, he gave a test to a bunch of people, and those that tested really a happy outlook on life, a happy disposition. You know those folks. Some of you are among them. These people similarly have a clustering of their endocannabinoid genes that look the same. So this reaches far into our moods and all kinds of medical issues. We're going to change medicine around looking at the endocannabinoid genes, because what we used to say is idiopathic. We don't know the cause of this disease. Now we're going to be able to point out and say, these are endocannabinoid deficiencies or endocannabinoid variations. They don't all work the same. This is my own experience in my practice. This list of conditions are in rank order. Pain is probably by far the dominant condition, acute, chronic, and neuropathic pain. Mental disorders, really of all kinds, benefit with cannabis use. Cancers, gastrointestinal disorders, insomnia, migraine. Harm reduction is bigger than you would expect. People are able to get off of more dangerous drugs, even just the polypharmacy of American medicine using cannabinoids. Or if they need to quit tobacco, or if they need to quit alcohol, or whatever, cannabis offers a nice way out. It is a harm reduction substance. Spastic disorders, there's nothing better that I've seen in medical practice for spasticity. Autoimmune disorders, neurodegenerative disorders, glaucoma, skin diseases. I'm getting at the bottom of the list here. I grouped a few more together. Epilepsy, autism, Tourette's, ADD, dystonias, and dementias, AIDS, and other infectious diseases. The Lyme's patients do well. The Hep C patients do well. So things that augment the natural endocannabinoid system. Again, going back to that first phrase of the patent, no, not the patent, the article by Packer and Kunos at the NIH. Modulating endocannabinoid activity may have therapeutic potential in almost diseases affecting humans. Well, the clinical use of plant cannabinoids finds a wide range of utility over a broad spectrum of conditions, as I was showing that list from my practice, and various activities will also temporarily upregulate the endocannabinoid system, such as massage and manipulation, exercise, and acupuncture. When these procedures are done, you briefly get an upregulation of your endocannabinoid system. It makes you feel good. It reduces inflammation. You get a little benefit from it, but it's not very long lasting. So what we're doing with cannabis, there are some medications out there right now. Marinol is just synthetic THC. Sesamet I haven't seen used yet. Sativex is in phase 3 clinical trials, not available in the US. It's in Canada. It's a little oral spray of a balance of THC and CBD. Epidiolex, around this, remember when Sanjay Gupta a couple years ago talked about Charlotte Figge with the seizure disorder in Colorado? Epidiolex followed that immediately because people from all over the country said, we want access to this as well. So out came Epidiolex, which is 99% CBD as an oral product, as a gel, 1% non-THC cannabinoids. I might add that taking the THC out of this is totally a political decision. THC is a great medicine for seizures, but because the feds don't want people to feel good, they take out the THC. And then there's cannabis and the flowering tops of cannabis that we're using as medicine and all of its derivatives. Optimizing the effect is really about methods of administration, the ratios of THC, CBD, and other cannabinoids. There's the question of decarboxylated versus carboxylated THC. I didn't show that picture, but in the green plant, THC is in a different form. It has an acid moiety on the side of the molecule, and it makes it's not been decarboxylated. It still has this carboxyl group on the molecule. It doesn't get you high. So THC acid, the carboxylated THC, is not psychoactive, and people can use large amounts of THCA without getting particularly high. The dosage is always very key to the use of cannabinoids, and you'll probably, for any of you who recognize cannabis, there's a point where you just go, okay, that's enough. If you eat it and ingest a large amount, you're in for the ride, and you're going to be in for however long it's going to be and however big a dose you took. You can't hurt yourself, but it's going to be, you're in for 5 or 10 hours, if not more. And then the frequency of use is commonly an issue for people using cannabinoids. I'll keep moving. This is a little too heady, but some of the research by Marilyn Houston in Washington, D.C. has shown that smoke and vapor, more or less about, anywhere, I'd say generally about 10 to 50% of of the cannabinoids in smoked or vaporized cannabis get into your bloodstream, something in that range. Oral forms, quite a range there too. I think this is unfair in terms of the percentage that gets absorbed, because I really think a lot more of it gets absorbed than Eustace is showing. In many cases, she's just talking about single molecule THC, and how it was administered becomes an issue. You probably get a pretty good portion of it orally. Suppositories are a very, very effective way to use it. And when it gets into your body by way of the suppository, it doesn't go through the liver first thing. It goes into the circulation coming up from the legs, up the vena cava, into the heart, and then around the body, eventually getting pumped through the liver enough times to where it's inactivated. But these forms are far less psychoactive, and people are beginning to use them when they want to use high doses of cannabinoids, particularly in cancers and other conditions that need that. And then there are a variety of topical uses, some for killing skin lesions, cancers, keratoses, and all those sorts of things, but also to some degree getting relief from pain by just putting a tincture or a alcohol, infused alcohol or oil on your joints, and then the pain is relieved. People recognize this and use it topically quite a lot. The metabolism, I think for sake of time, I'm going to move through this. These plant cannabinoids are metabolized in the liver. All the other cannabinoids, the natural ones, are metabolized on site wherever they're being released. I think I'll skip over that. This is kind of useful though. You see THC is noted in a short line, broken line. When you smoke cannabis or vaporize it, you get a peak very quickly, within 10 minutes. And by an hour, most of it's gone. And then the first pass metabolite in the liver is this little lump here, and then by 2-3 hours it's gone. So smoke and vaporized cannabis is excellent for certain needs, but you get a lot longer duration of action if you're going to take it by mouth. This is the ingested cannabis metabolic graph. So you get the peak in about 2 hours, and then you have more like 5 to 10 hours of activity of the cannabinoids. For many conditions, this makes much more sense to take something by mouth, so you get a lot longer duration of action. On the other hand, if you have acute pain and you need relief right now, or you're feeling a migraine coming on, or you sense that you're getting an aura and need to treat your, migraine or seizure or whatever, smoking or vaporizing is rapid and is going to get into your bloodstream right away. The cannabinoid ratio, I'm talking about cannabinoids here as a class of drugs. In the marijuana plant, there are about 70 different cannabinoids, maybe as many as 100. A lot of different ones. THC and CBD are what we hear about. THC in regular marijuana is about 99% of the cannabinoid, and the other 1% is all of the other ones, including CBD. If you're looking at industrial hemp, it's pretty much the opposite. CBD is the dominant cannabinoid, and THC is one of the minor cannabinoids. And then we've come to discover over the last 10 years now that there are a few plants that come through the dispensaries. It was very helpful when Harborside across in Oakland began to look at every marijuana that they sold. They analyzed it, and about 1 in 600 plants was rich in CBD. And so we began to identify not only CBD, but strains that were rich in other cannabinoids, some of these other minor ones, THCV, CBG, and so forth. So these cannabinoids may have particular value in certain conditions as we go along. But right now, suffice to say that we do have CBD-rich marijuana that's available to people. You can get it as flowering tops, buds, and if you toke on that, it doesn't get you as high for the reasons that I mentioned before. And then there are strains like the one Charlotte Figge used in Denver, in Colorado, which is way dominant CBD, more like industrial hemp. It's about 20 to 1, maybe as much as 30 to 1 CBD to THC. So it doesn't get you high, but it has these nice anticonvulsant properties. There are other rare strains beyond what we need to talk about. So we do have different ratios in cannabinoids in cannabis. That plays in quite importantly to what you're trying to treat and how your sensitivity is to getting high with cannabis. There's synergism of these cannabinoid molecules. I'll show you some graphs on synergism in just a moment. It's very impressive. That's to say that these molecules work better together than they do individually. You can't really extract them and use them in the same way. Well, you can, but you have a better medicine when you use the whole plant. There's some research out of Israel, suffice to say, just a year ago, they showed that when you compare CBD as a single molecule to the whole plant CBD, as is common in these plants that I was just describing, the CBD-rich plants, you go from what's called a bell-shaped curve of effect to a linear curve, which is to say that when you're giving single molecule CBD, if you give just the right amount, you'll hit the peak effect of diminishing inflammation and paw swelling in the lab animals that they were testing. And then if you kept going up on dose, you lose the effect. So it's a bell-shaped curve with the single molecule. When you're using the whole plant, it's linear. The bigger the dose, the bigger the effect. So it just underscores the importance of the whole plant as something far better than the individual molecules. There's an entourage of effect of these molecules together, not only the cannabinoids that I'm speaking of, but the terpenes, the molecules that gives it fragrance. The terpenes come with names like limonene and pinene, and they give aroma to the plant. The cannabinoids are colorless and odorless. So when you smell marijuana, you're not smelling cannabinoids, you're smelling the terpenes and the flavonoids and other molecules. When they work together, they have much more potent effects, whether you're treating cancers or anything else. The flavonoids and the terpenes have medicinal properties, and we like to be able to take advantage of that in the entourage effect. Some details I don't know that I need to speak of too much, except I do want to touch for a moment on cannabis as an adaptogen. Our friends in the naturopathic medicine trade speak of cannabis as an adaptogen. And to me, what that means is the same plant that you might use at bedtime to help knock you out and go to sleep can be used in the morning, and it won't knock you out and make you go to sleep. It'll get you going and get your day started, and you're going to feel comfortable and go about your day. So it adapts to the needs of the body. It's quite remarkable in this. Again, it's about homeostasis. And if you get up and you need to eat and you need to get busy and go, you can use cannabis at that time of day, the same product that you could use at bedtime and go to sleep with. So it doesn't compel, it just aids in homeostasis. There's a wide range of dosing. In the lower doses, I've shown as 1 to 5 micrograms per kilogram per day. That's to say, in milligrams, if you get 2 or 3 or 4 or 5 milligrams, that's a dose for many people, and that's all they need to take, and it'll give a nice easy feeling to whatever their medical problem is. And other people, we may go up to 1,000 milligrams if we're treating a cancer or something that really needs a much bigger dose. These molecules are remarkably safe. You can't really hurt yourself. You can knock yourself down with them. You might have to sleep it off for a day, but you're not going to hurt yourself. Tolerance and autoregulation. This is something about high doses. If you're using them for a cancer, for example, you can start off with a dose that will knock you on your can, and you'll be a lump on the couch for a day. And you wake up and take the same gram of cannabis oil, and you're down again for a day. By the 5th day, you can get up and go about your business pretty much as normal. It's not that you don't feel it, but you become adapted to it. You become tolerant to it. And what's happening is that receptor that I was showing in the membrane earlier in the pictures comes into the cell. It's internalized. And when you internalize that receptor, a lot of the high goes away and you become much more functional. So one would ask, well, if it's internalizing the receptor, does that mean it's losing its effect? As far as the high goes, you're losing some of that effect. But there are a lot of other targets of the cannabinoids that make it very important in some people to have a big dose. And that gets into the issues of cannabis and cancer that I hope I'll have time to touch on. I'm going to move on beyond this, except, I'll touch on it. Costa's work. She has shown in Italy that if you put THC into an animal with pain, it helps with pain. If you do CBD, it helps with pain. You put the two together, it works much better. McAllister in San Francisco did the same thing with killing brain tumor cells in test tubes. He used THC, it killed some. He did CBD, it killed some. You put them together, and it was remarkably more potent. I think I have that slide coming up. I'll go to it. These are these tumor cells that I'm speaking of. They were from a patient from UCSF, patient number 251. They're grown in a test tube, so these are brain tumor cells grown in a test tube. You put THC in them at that dose here, and it knocks the viability of the cells down this much. If you put CBD at this dose, it knocks the cell growth down this much. You put the two together, and here's your growth. You get it? Marked synergism. They work way better together. It's more than additive. So you got the 1-2 punch going. The CBD is not working as a receptor stimulator. It's working on the DNA of the cancer to try to block its reproduction. This is basically the same patient with a lesser dose of both THC and CBD. You can see the columns are a little taller. When I take time to explain this to a cancer patient, what I'm saying is this demonstrates the dose response. A bigger dose, a bigger effect. So you try to get people to take as much as they can tolerate. Some cancers can do well with very small doses, others really need a big dose. Preparations, we have flowering tops, keef, hash, and the flowers. We have oils. Some are alcohol extracted, some are supercritical CO2 extracted, which is to say if you put CO2 at 1,800 pounds of pressure, it acts like a solvent and strips the oils off the plant. There's tinctures, glycerin, olive oil, coconut oils. Many different oils can be used to infuse with the cannabinoids and then use that as your medicine. We also have salves, suppositories, and various foods are available with cannabis. So depends on how clever you are in making these food things at home, but they can all be purchased in dispensaries. So what are the limitations? There are significant social and legal issues here. People are afraid. They don't want to get involved. They're just feeling like they'll be discovered, and so they're unwilling to take a chance. They just are worried about if they're going to get a job or be tested in their jobs, that they aren't going to be employed because they test positive. So these are some of the biggest limitations to our using it. The cost is not insignificant. In California, we can grow our own plants, so that changes the equation dramatically. If you can put the plants in the garden and have them growing out in your flower bed, you can grow pretty much all the marijuana you need with just a few plants in many cases. Altered performance, yes, it's real. I mean, you don't want to get all loaded up and go become, a operator on a switchboard or whatever it might be. Those parts of the brain that are involved in short-term memory are altered, and your short-term memory is impaired for a little while. And there are other adverse effects: spaced out, woozy, sleepy, loss of balance, dry mouth and mucous membranes. Those are most commonly described. So there's some limits, and it's all about finding what you need and choosing strains that seem to be best for you. There are some precautions. In people that are new to cannabis use, there's occasionally anxiety and panic in the inexperienced user, or with massive overdoses, people get scared. There is a risk of fainting or fall, especially in high doses. People may hear of dabs. Dabbing is smoking the very concentrated oil, and you can get such a large dose, it's like smoking a whole joint in one puff. And when you get that big a dose, relaxing blood vessels in the body, all of a sudden, boom, you're down. You can faint. So you have to be careful with that. Smoking does cause bronchitis. And the physician, the professor emeritus of pulmonary medicine at UCLA, Donald Tashkin, his research into cannabinoids has been, in Fred Gardner's words, the greatest story never told. Basically, Tashkin has worked for 45 years for the federal government to show harm. He can show that it'll cause bronchitis, but it doesn't cause alteration of pulmonary function, it doesn't cause cancers, it doesn't cause COPD or emphysema. It does cause an irritation to the airway. Is it significant? After all these years in my practice, I would say by far the majority of people still smoke as their preferred method of use. Vaporizing is coming in. But those two really dominate as far as how people are using it mostly, and it's not really a risky behavior. There's some research that I could quote, but I don't think we probably have time for that, right?
We have just a few more minutes.
A few more minutes, okay. Dementias. Demented behavior, these are some of the bigger problems that people experience. Agitation, anxiety, psychosis, restlessness, anorexia, anger and aggression, depression, pain and spasms, and insomnia. When we give cannabinoids to people with dementia, Alzheimer's dementia, it quiets all that down. It's quite remarkable and been changing the lives of not only those patients, but the families and the staff of people who are looking after these people with moderate and severe dementias. There was some research done by this lady, Lisa Eubanks, down at Scripps, and she said that THC competitively inhibits the enzyme acetylcholinesterase, increasing the neurotransmitter cleft acetylcholine, like I was speaking of before, as well as prevents the acetylcholinesterase-induced amyloid beta peptide aggregation. That's what happens in Alzheimer's disease. This amyloid protein gets deposited in the nerves, screws them up, and the brain doesn't work right after that. So when she compared THC to the common drugs used to treat dementia, her concluding remark is, compared to currently approved drugs prescribed for the treatment of Alzheimer's disease, THC is considerably superior inhibitor of that amyloid beta aggregation. We don't quite know all of what it'll do in this population. Usually in Alzheimer's dementia, people are on their last years of life anyway, but it does seem to stabilize them clinically. They're happier. They get a laugh, they talk, they do things that they weren't doing before. They may not recognize their family. It's not necessarily reversing the disease, but it does seem to make a great difference for these people with Alzheimer's dementia. There are no FDA-approved medications for agitation. There are some box warning drugs that are commonly used. I'll show you a list of those here. This is just a partial list. The list is long, but Zyprexa, Geodon, Deseril, Haldol, Risperdal, Cymbalta, Seroquel, Abilify, Navane, Clozaril, Celexa, to name a few. These are black box warning drugs. What that means is if you pull out the package insert and read it carefully, it says there's a risk of killing patients with these drugs. And what do you do when the behavior is bad? You give more drugs. And so these people are doing bizarre behaviors. Here's a list of what we are going to evaluate these patients in a Alzheimer's dementia center. It's too small to read, but the agitated behaviors are really a trip. And if you can quiet down these bad behaviors, you're doing a favor to not only the patient, but everybody. The families are much happier. Next. Well, or not. Here it is. Cannabis cancer. I won't spend long. I'm going to zip through these. There are receptors that I've been talking about, the CB1 and CB2 receptors. There are other receptors that will receive the cannabinoids, but there are non-cannabinoid receptor signaling pathways. And if you look at the research, these are named by the cancer researchers as pathways where cannabinoids can stop the growth of cancers. If you block the cannabinoid receptor, there are chemicals known to be able to block the receptor. If you do that in a laboratory animal, tumors proliferate. So the natural system to get rid of cancer cells, tumor cells, cells that aren't working properly, is by way of our natural cannabinoids. And when it's activated, it kills off those receptors when we kills off those cells. And when you block that receptor, it doesn't do it anymore, and tumors can proliferate. In my own experience, these are some of the tumors that seem to be responding. This is anecdotal, but it's impressive to me as a clinician as to people having these cancers and doing very well with cannabis. Too much to talk about. This is one case that I love showing because it's a little baby that was brought to me at 11 months of age. Here's his brain tumor, this big white lesion. The surgeon said we can't touch it, we'll kill the baby. The oncologist, the chemo doc said, we can treat this. And the radiation doc said, we can treat this. And the parents asked the hard questions. Well, what's going to be left of his brain? They didn't like what they heard. So came to me. We started squirting concentrated cannabis oil on his pacifier and popping it in his mouth twice a day. 3 months later, you can see the tumor shrinking. 5 months from the start, virtually gone. This just doesn't happen otherwise. So sometimes tumors are very sensitive to cannabinoids, and it's really a thrill to see this little kid running around the office at this point. In gastrointestinal disorders, I'm not going to spend time to talk any longer, but there are receptors in the gut. Some are in the distal neurons, some are in the white cells circulating around. In Crohn's disease, we're downregulating all of these things. We're decreasing intestinal mobility and secretions and pain and inflammation and on and on. All these things are beneficial effects on the gut and its diseases. These are some of the things that we ask of 38 patients in a study that I did a few years ago. And these are the results. Each paired column is one patient. The red one without cannabis, the blue one with cannabis. So you can see the stools per day markedly diminished. You can see pain was markedly diminished. Appetite way up, nausea down, vomiting down, fatigue generally down, depression remarkably down, activity up. People feel better. They don't have to move their bowels so often. They get up and go and can live a much more normal life. Weight is generally up a little bit, but not a lot. People don't have trouble with excessive weight gain with cannabis. Flare-ups are down, and flare-up severity is down. And when you ask the patients about this, they make some remarkable comments that are all the same among all 38 patients. I think I've run my time out. I'm ready for hearing from you. Thanks for your attention.